Kirsten, hello, how are you?
I'm okay.
I looked at Ginny's images. Unfortunately, she suffers from craniosynostosis, as we suspected.
Okay.
Can you tell me a little bit more about Ginny's symptoms?
She cries all the time. I consulted 5 or 6 doctors, but no one really helped. They said I should let her cry, that I
Uh,
shouldn't spoil her, but I was sure something was wrong. She's in a lot of pain.
oh, sorry to hear that. Ginny has the condition craniosynostosis. I'm really impressed at how brave Ginny is. She's a strong child.
That's true, she is. So, what are the options?
Well, my greatest concern is reducing what we call intracranial pressure. We can do that with surgery.
Surgery? That sounds really dangerous. My pediatrician said it could be fixed with a molding helmet.
Unfortunately, the molding helmet wouldn't help now. Every surgery has several risks, especially head surgeries. Jenny's a healthy baby otherwise, so that you know, eliminates a lot of the risks right there.
Well, I'm really concerned. What exactly would this surgery involve?
Well, two options. She's 6 months old, so we can do a minimally invasive procedure, or we can do the traditional surgery with the traditional approach. My craniofacial team and I, we make an incision on the head. After that, adjust the sutures, and then we return them to a normal position, and afterwards you shouldn't have to see any incisions or scars or anything.
This sounds really difficult.
Unfortunately, yes. I mean, it's a big surgery. It can take up to 8 hours. The operation does, involve expertise from a number of different specialists working together. Jenny has to be in the hospital for 3 days after that.
If Jenny has this surgery, do we know that she'll be without pain afterwards?
Unfortunately, there's no guarantee that the condition will be completely gone after the surgery. But you know, because some children they have a little bit of pain, but we can always manage that with medication. Or in some cases, a child may have a situation where we have to do the operation over again. That's extremely rare. So.
Sorry for so many questions. I just want what's best for my daughter, and after all the bad experiences, I want to make sure.
Yeah.
So, what about the other procedure, the minimal one?
Well, no worries. It's important for you to ask questions. The minimally invasive procedure, we call that endoscopic procedure, and that's when the baby's younger than 6 months. That surgery only lasts an hour, and she would have to be in the hospital only one night, probably go home the next day, need to wear a molding helmet for 6 months after that, check it every 3 months.
Okay. Is the helmet painful?
No, it's not painful. But she would have to wear it consistently. After about 6 months, if the growth is not normal, then we may need to do the operation over again. That's really rare, though.
This is so overwhelming. How do I decide what's best for Jenny?
Yeah, I know it's overwhelming, and there's a lot to consider here.
And you're sure she needs surgery? The helmet alone is not going to work.
Unfortunately, yes, she needs the surgery. Plus, if you wait a month, then the minimal procedure wouldn't be an option. So, I recommend that you talk to some other specialists in this field, because the more information you have, the better you'll feel about your decisions. So.
Okay.
I'll have my assistant print a list with the contact details of my colleagues. And,
Thank you. This is very stressful.
um, I'm sure it's very stressful and exhausting. Do you have family or friends that you can, talk to, or?
Yeah, my mom.
Okay, well that's good. It's good that you can talk to your mom, get support from her. Any other questions for me, or?
No, not at the moment.
Okay. Well, you got a lot of information here. Think about it for a few days. Go out and get that second opinion. Let me give you some info. This is a pamphlet that has information about craniosynostosis and treatment options. And
Thank you.
again, if there are any questions, just let me know.